Welcome back. People 65 and older are considered to be especially vulnerable when it comes to coronavirus. That's partly because older adults and those with underlying medical conditions seem to be at a higher risk for developing complications.
Yeah, geriatrician Dr. William Dale is with the City of Hope. He joins us now to give us his perspective. And doctor, I imagine most of your patients are very, very concerned with this virus spreading like it is.
Yeah, they've certainly heard the reports like everyone else that they're at higher risk, especially if they have those underlying health conditions. So it's a combination of them being older and having those conditions, and they're very, very concerned and trying to avoid any chance of getting the virus from other people and ending up in an emergency room or a hospital if possible.
Distancing, it can be especially isolating for our seniors. What are some best practices to keep them connected so they don't feel so lonely?
Yeah, and I appreciate using the term physical distancing. I've been a little bit of a rebel on the social distancing because we want to maintain physical distance, but the emotional and social connections are still important. Whenever possible, trying to use technology is a good idea so that we can use Zoom or iPads or whatever is necessary. But to be honest, some of them prefer just the good old-fashioned telephone. And I've heard some of my patients are actually having their families come to the curbside or stay outside their window and talk on the phone. So finding ways to get around the physical distancing, but maintaining some connections is really important.
Doctor, we have seen a big problem in nursing homes, senior centers. We knew these were going to be problem areas. Do you think enough has been done or should have been done sooner to protect those populations?
I think what's happened is it revealed some of the weaknesses in the system overall with our nursing homes. I've worked in those nursing homes, and they're just very, very resource deprived places, and so people are doing their best. We probably should have anticipated it when we saw that it was older people and people who were sicker, and that's just a call for a nursing home problem. I think we've now starting to catch up quickly, especially in California with the new policies that are going out and are in place. But I think in the future, we're going to have to think harder about investing, especially as long as we don't have any cure for this COVID situation.
And doctor, I know so many people, myself included, so just anxious about my parents, my grandparents, all of us really are feeling this way. What advice do you have for us?
It's the same advice we give other people, but have a heightened vigilance for it. Washing your hands for at least 20 or 30 seconds if you go over. Always wear your masks. Make sure that you're doing everything you can to avoid transmitting the virus. I do recommend people check in on their older relatives, friends, family, even going over, as I said, stand at the curbside, talk to people on the phone. If you do go into the house and bring things for them, food, whatever, make sure they're all wiped down. But really think creatively about how to maintain the physical infection risks and minimize those while you continue to connect maybe a little more often than usual so they don't lose sight of there's a world out there and they don't become too isolated.
All right, Dr. William Dale, thank you so much for being with us and the work you and your colleagues continue to do. Thank you.
Thank you. Nice to meet you.
Thank you, doctor. Still ahead, some good